Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to speak about intercostal neuralgia. Intercostal neuralgia is caused by impingement or pressure on an intercostal nerve. The intercostal nerves are located between the ribs. The symptoms of intercostal neuralgia include pain along the course of the intercostal nerve in the intercostal space, band-like pain wrapping around the chest and back. It can be from posterior to anterior or anterior to posterior. The pain is described as intense, sharp-shooting shock-like pain, stabbing pain, or deep burning pain, or constant deep, dull ache. Paresthesia, such as numbness, tingling, and burning, may be present. It is aggravated by motions of the ribcage, especially bending towards the side of the pain, rotation, coughing, sneezing, laughing, and deep breathing. The pain may be constant or intermittent. The symptoms of intercostal neuralgia also include limited active and passive range of motion in all planes, especially when bending towards the side of pain due to pain and muscle guarding. There are slow, guarded, and apprehensive movements. There is usually an altered posture, or what is called an antalgic posture, because you are bending away from the side of pain to lessen the impingement and the symptoms that it causes. Symptoms of intercostal neuralgia are labeled as being neurological or radicular symptoms because the source of the symptoms is nerve pain from an impingement on the intercostal nerve. The origin may be traumatic or non-traumatic, and there is always a possibility of a thoracic spine disc herniation or disc bulge when there is pain, especially nerve pain in the rib cage. If you have seen any of my other videos, you know that I always mention prevention. Prevention is faster, easier, and less expensive than injury rehabilitation. So use all the tools you can to prevent intercostal neuralgia. These include having a balanced training routine where you are building proportional strength when you compare the muscles in the anterior part of the rib cage and shoulders with the muscle in the posterior part of the rib cage and shoulders. Other prevention techniques include performing normal breathing exercises where you are strengthening the diaphragm and learning to breathe properly using the diaphragm. Posture correction exercises. If you have a postural fault, perform exercises that will help you to correct the postural fault. Eliminate strength imbalances. If you have a strength imbalance, especially if the muscles in the front of the shoulders are stronger than the posterior shoulder muscles, you want to train so you eliminate the strength imbalances. You want to perform stretching exercises for the rib cage. You want to perform pull-up bar hanging traction, also known as dead hangs, to traction and decompress the spine, specifically the thoracic spine, and it'll also help to stretch the rib cage. And you want to strengthen the scapular retractor muscles. The scapular retractor muscles are the rhomboid minor, rhomboid major, middle trapezius, and lower trapezius muscles. These muscles pull the shoulder blades towards the spine. That motion is called scapular retraction. Disclaimer alert. Please realize that watching this video does not take the place of seeing a medical professional. Please see a medical professional if you think you have intercostal neuralgia or any other type of health-related condition. Again, watching this video does not take the place of seeing a medical professional. Please do not self-diagnose yourself. You can see a doctor of chiropractic like myself, or you can see another type of medical professional. But please see a medical professional so you can get an evaluation, a proper diagnosis, and a treatment plan to set you on your road to recovery. When you are performing exercises to prevent and rehabilitate an injury, always perform exercises through a symptom-free range of motion, even if that motion is very small. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, stop immediately and find a viable substitute. Always begin all strength and fitness exercises at your current health, fitness, and strength levels. Do not try to start at what you used to use when you were younger or when you were injury free. And always remember to progress in your volume and intensity in small, gradual, calculated increments. As a doctor of chiropractic, I have treated many cases of intercostal neuralgia. Intercostal neuralgia is impingement on an intercostal nerve, which is located in the intercostal space. The intercostal spaces are located in between the ribs. If a patient comes into my office and I suspect that they have intercostal neuralgia, I'm going to do a thorough examination on the ribcage and on the thoracic spine, the cervical spine, and the lumbar spine, and the shoulder complex. Chiropractic treatment will consist of what is called a chiropractic adjustment. The chiropractic adjustment is restoration of proper skeletal motion, which helps to optimize nerve flow. The chiropractic treatment is performed to eliminate the source of the condition. In intercostal neuralgia, the source of the condition is impingement on the intercostal nerve. So the treatment would be performed on the ribcage and on the thoracic spine and in any other areas where there is a lack of proper motion. If you have been diagnosed with intercostal neuralgia, you can perform the same exercises that I spoke about for prevention as rehabilitation exercises. You can perform normal breathing exercises, postural correction exercises. You can perform strengthening exercises for the scapular retractors. You can stretch the rib cage, and you can perform pull-up bar hanging traction, also known as dead hangs. Again, start any type of exercise program at your current health, fitness, and strength levels. Never perform an exercise that elicits or intensifies symptoms, and always perform all exercises through a symptom-free range of motion. When you're performing stretching exercises, move into the stretch slowly, hold a mild, comfortable stretch, and move out of the stretch slowly. Thank you, everyone, for watching today's episode of Dr. Ozello Sports Medicine Report, where I described intercostal neuralgia. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can find additional information on the book, and you can also find my blog. My blog contains articles on chiropractic care, spine health, sports medicine, health, fitness, and nutrition. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below. Please subscribe to my YouTube page, and always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free, rehabilitate your injuries, and accomplish your goals.